Welcome to the Pickleball Recovery Podcast, where we highlight products and practices to help you feel better faster, so you can spend less time stiff, sore, and injured, and more time on the court doing what you love. This podcast is sponsored by Zamst. Zamst reinforces and protects athletes by providing premium technical products in the form of athletic braces and supports derived from innovative materials, designs, and manufacturing processes for the ankle, knee, elbow, and more. Find out more about these high-quality products built to prevent injury, improve performance, and ultimately help you spend more time on the court at www.zamst.us. And use the code PBR to save 15%. What's up? Welcome to another episode of Pickleball Recovery. I'm your host, Tim Ringgold. How you doing? Did you play any pickleball today? I hope so. It's pretty much nice everywhere at this point. I played yesterday some good pickleball. Woof. And I'm playing in a tournament tomorrow, local tournament. Very excited. Round robin. I love a round robin tournament, you guys. Value for your money. Nothing better, in my opinion, frankly, because you just get more looks, you get more pickleball. I love it. I played in one last weekend that my partner, Mr. Tim Cook, and I took gold in. That was quite fun. But can I just be really honest with you guys? It was at the Pasadena Senior Center. The Senior Center. Yes, it was the Pasadena Senior Games. And I want you to know that the 12-year-old inside of me was horrified that the 51-year-old outside of me can qualify to play in a tournament run by a senior center. When did that happen, you guys? That is terrifying. I'm deeply troubled, existentially troubled by this, that I am old enough to play in a tournament appropriately. It's not like I was crashing the party. Appropriately. At the senior center. Yeah. It happens. You're all going to get older, but I'm not going to get old. I'm just going to get older, and then I'm going to die, but I'm not going to die old. I'm going to die young, mentally, socially, spiritually, physically. I'll die older, hopefully, God willing. But yeah, man, there's a difference between growing old and growing older. I grow older, but I maybe grow wiser. I don't know. We'll see. Time will tell. But aside from all that, let's see. Should we talk about this episode? I think we should. It's pretty cool. I mean, I might be biased, but this is a cool episode because it's a combination. It's kind of like when I interviewed Darren Lancaster and Dr. Ethan Kreisworth from Ghost Leaves not too long ago, in that it's three middle-aged bald men having a conversation. No, I'm kidding. I'm not. It was three bald men having a conversation again. Can I just tell you guys, I think being middle-aged and shaving your head today is going to be the equivalent of the comb over. I know, I said it. Hot take. You heard it here first. I'm one of them. I think it's a thing. You know what I mean? I think it's like a generational zeitgeist. Like there's like bell bottoms, or day glow, or fanny packs. I think cue ball, 8 ball, whatever color your head is. I think it's a thing right now. I wore my hat in this video, you guys, just to break up the bald blindness factor in the video. Just like in the last one, what you didn't know was when we got onto Zoom, I was wearing a wig for the last interview just to break up all the baldness, but I digress. What I want you to know about this interview, why this is so cool, is that this technology that you're going to find out about, it's called vibration technology, and it's not like power plate vibration. It's like targeted. And then the technique is called targeted vibration therapy. And so that's why both Calvin Clement from Rapid Release Tech is on as the technology, but then Dr. Matt Gloyd, founder of Targeted Vibration Therapy, is talking about the technique. So it's technology plus technique that gets results. Now, how do I know this? Because we shot this video before that tournament. It was the morning and the tournament was in the afternoon. Now, for months, you guys, I have been playing with one of those ghost leaves on my right knee because I've been having issues with my knee. especially if I'm going laterally, like out wide to the right, like taking a dink on my inside foot if I'm playing on the left, or on my outside foot if I'm playing on the right. Really struggling. So there are some like demonstration videos at the end of this. And I want you guys, if you're listening to this, I want you to go onto YouTube and go to the end of this and watch the videos, the demonstration videos, because you're going to see how little time it took Dr. Gloyd to open up my leg, and you will see the difference. It's unbelievable because I played the tournament without my knee brace. We won the gold, but more importantly, I was in beast mode for the final 2 games, and I was completely unleashed. There was no guarding, no worry, no weakness, and I had all the power and stability I wanted. I could have played 2-3 more games easily. So real testament that it's the combination of the technique plus the technology that is so impactful. So sit back, relax, enjoy the ride, and I'll see you guys on the other side. Calvin Clements, Matt Gloyd, welcome to Pickleball Recovery.
Thanks for having us.
Oh, it's great. I'm so stoked that you're here and that we're here, that this worked out. So for those of you who are listening on audio, as usual, I will implore you, go watch the video. And if I'm saying this to the camera, so those of you who are watching this already, you're already here. So thank you for being here. We are at the beautiful Mission Inn in Riverside, California. This is like not what Southern California looks like. When you roll into the Mission Inn, you're just like, what? What is this little tropical paradise? And just the fate conspired to bring us together on an early Saturday morning. And I'm so happy it worked out. It's just like we've been on each other's radar for probably over a year at this point, and it worked. Giddy
Fantastic.
up. Yeah, I'm so happy. So what we're going to talk about today is we're going to help educate people on understanding the difference between percussion and vibration. 2 different things.
100%.
Yeah. So, and we started it right out of the gate. I had pulled out this weapon over here that often is in my travel bag. And I made a joke because for those of you listening on audio, I have a Hyperice Go percussion massager, which many of us have seen all kinds of percussion massagers at courtside at a tournament. And I went, boo, I was joking like it was the dark side. And Calvin, immediately you helped to kind of change my view on that. So right away, what was it that you told me beforehand?
So we don't see percussion devices as competition. We believe that there's several modalities out there that complement the therapy that practitioners provide. So the Hyperice is a great tool. Therabody is a great tool, but they all serve different needs. Vibration for us is a full body application, right? So with it, and I'll let Matt dive in deeper, but with it, you can treat from plantar all the way up to TMJ, your occipitals, go over spine, bony prominences, and more. Where for percussive devices, you're relegated to large muscle groups for the most part.
Yeah.
Think gastroc, calves, think quads, hamstrings, glutes, etc. Right? So there's different techniques and protocols for both technologies, and then when you start to get into the science, that's where you have someone like Dr. Matt Gloyd here, who really dives into how the devices actually treat the anatomy.
Got it. Yeah, thank you for that, because at first I was just like, oh, this is just like a upgrade on the other thing. And really, we're talking about 2 different shapes on the pegboard.
Exactly.
Nice. And for anyone who's ever made the mistake of putting this on a bony prominence, I'm holding the Hyperice, you guys, on audio. You'll know, oh, that is the wrong tool for that.
Right.
I'm glad to hear that can be applied in that way. Tell me just quick backstory on the product, the name of the product, and its origin story, because everybody loves a good origin story.
Sure. So the device was developed by a chiropractor, Dr. Stanley Stanbridge.
Okay.
He's based out of SoCal. He was looking for a way to treat his patients, increase pliability before manual therapy, so he played around with vibration.
Got it.
From there, he really found some amazing results, took that 12 years ago and applied it to what was the first device called a Pro 1.
Okay.
There's a second owner by the name of Jeff Mayer. Those 2 came together. Jeff handles a lot of the sales and marketing and more, and those 2 went on a mission to serve the world, right? And then enter me probably 5-6 years ago. I was interested in technologies that helped. I had a torn rotator cuff and dealing with some really tough adhesions and restrictions and trying to find ways to resolve that. I ran into the company and said, wow, I've never seen this, heard of this, experienced it in college, etc. So in turn, I met Dr. Stanbridge, and we decided to kind of take this journey together. And Matt, in the same kind of parallel way, was introduced to me, and it's been fast forward ever since.
That's great. There's a phrase in my clinical world called the wounded healer.
Okay.
And it's somebody who's been through it themselves and then found a solution. And then instead of just enjoying the solution, thought, well, how can I bring this solution to more people and help others the way I was helped?
Right.
And I find that the people I gravitate towards in the athletic recovery space, we were all on a treatment table first. You know, like when I used to go to my physical therapist, I would joke, because I played rugby, so I was there often. And I would joke that I reserved the right to take any painting on any of the walls home with me because my copay had paid for them. Because I had just spent so much time on the table as a patient first, right? And then it was just like, I knew what worked on my body and the difference. Certain things were great, and certain things I'd do 16 sessions of something and I'd be like, thanks. You know, and I don't really know. You feel better? I don't really know, to be honest with you. Awkward moment, Mr. Physical Therapist. But like, yeah, that modality really didn't do much for me, or that actually made things worse. But that right there, wow, what a difference. I had no idea. So,
well, one of the things that we'll introduce to you, I'll let Matt again apply the technology, but our device works really fast. So it's not a 30-minute or an hour type experience. It's immediate. So if you're dealing with aches and pains, you're dealing with restrictions, you're dealing with issues where you feel like you need to get back on the field, for example,
right.
This device, when applied, you will immediately know, wow, this thing is doing something and it's lasting.
That's brilliant. So yeah, let's dive in, like what's going on under the surface, Dr. Matt Gloyd. Tell us a little bit more about, help us understand, because since in pickleball, as a pickleballer yourself, you have seen, we were making the joke, for those on audio, I'm wearing an ankle brace right now that for many of the over 40 lot, we show up armed for battle with our various compression gear and our braces and our sleeves and our guns and our rollers and all the things that we pull out of our bag, including the pain creams and other such items. As a pickleballer, you've seen people out there grabbing a percussive massager. Can you just briefly set up what's happening when they put this on their big muscles so that they can, and then that way we can kind of set the stage for the difference between the two?
Yeah, so, I think it's just with any sport, especially pickleball, people are going completely nuts on the sport. And a lot of them, are former tennis players. They're athletic, and they know they're just going to go nuts and be an athlete out there, right? Then you have the older population who's trying to get into something, be competitive, but their bodies are not matching up with where their brain is, right?
It's been a minute.
So, you see tons of injuries. Some people refer to it as cripple ball. I actually like to back off that and defend it and say, listen, it's cripple ball for certain populations, but the reality is people are basically going nuts out there, and they're taking their bodies to an extreme level. If they, the ball dies, so you actually have to go down and, dip down and scoop it, and you're repetitively doing that, even when you have to pick the ball up to start the next point. There's a lot of bending down and forward, and that's what I recognize as a physical therapist is the problem child to a lot of why people are getting hurt. And they're also chasing down balls. It's a quick, instinctive move that the body is not quite prepared for. And so why somebody would use a hypervolt or a percussive gun initially is, hey, I have an ailment, I have a tightness on my Achilles or my calf, and I want to get out there and perform, so I'm going to use this modality to loosen my muscles up, okay? And the difference between this percussive tool, which is really the main category of tools out there, massage guns, we call them, you're going to have this repetitive striking of the connective tissue. Okay, so if the rapid release tool didn't exist, we would all be using these on a level that is pretty standardized. The difference between this modality and the rapid release technology is you have all these different heads on this device. So as a physical therapist, if you think of coming in for dry needling, there's actually a tip that can be an actuator tip that's like trigger point release on steroids.
Wow.
So 10,000 RPM, you're manipulating anything I could do with my thumb, my elbow. Take the best chiropractors, PTs, massage therapists. This is like Bruce Lee. Okay,
Wow.
so we just can't compete with the technology like this. Then you also have this plastic tip that's like scraping. So anybody who's had Graston, dry knee, A-stem, this is the new normal on. You can go right over the skin, over clothes. You don't need to take the time to put cocoa butter on the skin.
Right.
And
Lube
then
it up.
scrape it, cause somebody to bleed, and then take the cocoa butter off. That time is valuable, and we could just do this right over the clothes, right before you go play pickleball. You could actually essentially scrape your forearm if you have a little tennis elbow.
Yeah.
And then you have the flat side that's more broad for people with sensitive skin, or just introducing the vibration before you hit all these heads.
Okay.
So when it comes to pickleball, this is really an optimal modality to really free restrictions to movement. So as a physical therapist, increasing blood flow, freeing restrictions, allowing somebody to move better, not just preventative for injury, but also from a performance standpoint.
Yes.
So it's really, for me, I geek out on this stuff. One, I'm a pickleball crack addict like everybody else, but I also recognize that we don't want to just throw people out and say, go play pickleball without some, be prepared that your calf is going to cinch up, your Achilles will tug on the calf. So if you can provide more slack on all this connective tissue, you are probably in a better position to not get hurt and perform better at the same time. Double bonus.
Yeah, totally. And just, I know many of my listeners hear this because we preach it over and over again, but when you move better, you play better. Recently I was playing some, rec doubles, and I've been working hard on mobility, and which is kind of like humble pie as a guy. Like, the beach muscle days are gone. Like, now I'm spending the time that I used to spend lifting weights, doing mobility and really trying to have muscles glide. And this one particular day, I was just lights out, right? Poaching everything, just all over the court. And one of the guys just said, he's like, "You're moving so well." And that was the phrase. It wasn't "you're hitting so well." The hitting so well was a byproduct of the moving so well, right? Because I put my body in the place the way that it was supposed to be early, so that the swing mechanics all took care of themselves and the ball went where it was supposed to go, because the body was where it was supposed to be. And I was able to get the body where it was supposed to be because of the way that my body moved and how all that soft tissue is gliding and moving. And a lot of people come into pickle and they just, good enough is good enough, and they don't realize, they get frustrated with their skill set and they think they need to hit more balls. And really, it's like, if you can just free up some of this tissue in your lower body, you're just going to get to those balls earlier and you're going to hit those balls better. And then you're not going to wear out your shoulder or your elbow or your wrist or your forearm from all that over repetition. So, key piece.
One of the things we introduce a lot is connective tissue. So when you're thinking about, connective tissue, if you're having an issue, an ailment somewhere, most laymen who have maybe a trigger point or something around the calf, they think that, well, I'm going to take this percussive device and I'm going to work that area specifically, right? But we know that with joints, ligaments, tendons, and more, there's connectivity.
Yeah.
And so how do you treat that connectivity when you know that the origin of the problem is maybe stemming from your knee, or the origin is stemming from an Achilles and more? You just can't treat the one specific area where the pain derives. So we try to introduce, through Matt and his targeted vibration therapy curriculum, we try to introduce ways for people to educate themselves, understand fascia, understand connective tissue, and more. So he has some programs that allow us to fast track our therapists specifically and our clients, so that we can then turn around, and introduce, hey, understand your body.
Yes.
You're putting it through some trials and tribulations. How do you resolve these issues, understand it, and then pick up the device that you believe is going to best serve you? So that's our world, is more of an education and introducing vibration therapy than saying, hey, here's a device, use this.
Right.
We really want people to understand how these technologies better serve themselves.
Yeah, well said. It's like, I think of it like upstream and downstream is a phrase that I'll think in my head, like, where's the problem? Where's the symptom? And then where's the problem?
Right.
right? And you can probably talk to this as a physical therapist, right? Like you'll see a symptom is presenting somewhere and well, that's the symptom, but that's not really the problem. The problem that's causing the symptom is something else. And I think we still don't quite think that way. We think it must be like, oh, there's a shoelace untied somewhere and it's like right there. And if I just tie it, then we're done. Talk to us a little bit about how, and do we call it Rapid Release 3, the RR3? The name of this lightsaber right here?
So the device is called the Rapid Release Pro 3.
Pro 3, okay.
Right, but you'll notice on the bottom of that device it says TVT.
Okay.
So we try as much as possible to steer people into the education.
Great.
Right?
Great.
Before the investment.
Okay.
Right?
Yep.
So we want you to, hey, let me understand what the issue is at its core.
Yep.
Once I understand that, I'm better served with a technology to apply it and resolve the issues.
Yeah.
And that's where I always try to tee a few things up for Matt. He knows this. I put him on the spot all the time. But the goal is, hey, here's an expert, someone that knows the anatomy.
Yep.
We think we understand what's going on with, our issues, but go to a professional for a second, talk to them, understand what you're dealing with.
Yes.
Sometimes it's not chronic, but we feel that we've had this nagging issue for so long because we have not been able to resolve it.
Yep.
But the resolution comes from an expert.
Yeah.
And so if Matt doesn't mind, I'd love for him to talk a little bit about fascia as well and how his TVT curriculum and education techniques, protocols apply to fascia. And then you'll better understand how Rapid Release, a high-speed vibration therapy device, helps unwind all those restrictions.
Brilliant.
Yeah, so, we started this education platform, and I'll just kind of show these books here. So one textbook of the two is about fascia. It's about the physiology of stretching so that it kind of breaks down. It sets the stage for understanding how all these outcomes are occurring so fast in physical therapy and wellness. And so as you break this book down, it really does go from what are myofibril, what are muscle units, and it breaks it all down like anatomy. And then it gets into what's happening at the central nervous system, how we hack into the brain to basically allow the muscles to relax.
Yes.
And then the physical therapist, the chiropractor, the massage therapist, the consumer who's using the tool is now able to tap into a range of motion that they've never seen before. And basically that's how you get this magic to happen. But the fascia, if you think about it, I like to set the stage around this fascia conversation that 90% of people come in to physical therapy, chiropractic, massage with an issue related to, wait for it, cheat code, stiffness. Okay, as we get older, we don't get more flexible. We actually get more restricted.
Yeah.
Okay, the 90-year-old is struggling with stiffness. He's not hypermobile and jumping out of a gym doing the splits, right? So even as a 25-year-old, you start to kind of get more stiff because of your activity levels going down, or you just don't take advantage of the mobility type of thing.
So that was the high water mark. That was like high tide 25.
Yes.
So the long, slow descent into the grave starts at 25, my friends.
Wheels start coming off for the young viewers out there. WD-40, they probably have no idea what that is, but let's be honest, that is what's necessary as you age. So the fascia conversation, so 90% of people, if we find that they are coming in with a tightness problem, they had surgery, now more scar tissue, they had an injury, more adaptively shortening connective tissue. So if we know this, we know there's a relationship between tightness and pain. As we reduce tightness, we reduce pain. Then we know, hey, all we need is technology to free restrictions to movement. So take knee pain, for example, anterior knee pain with a patella problem. If we were to provide slack and lengthen connective tissue at the top-down approach with the quad, hip flexor, and then also the calf, the hamstring, we provide more slack. We allow that patella to slide and glide. And then now, shocker, less knee pain, more range of motion.
Right.
And literally, that is the cheat code to how in 9 years, I feel like I built a huge physical therapy practice in Arizona, partly in Dallas. And then this education platform is really to fast track consumers who buy an expensive device, but also more importantly, the professional, the chiropractors out there, the physical therapists, the athletic trainers, so that they start to see the framework around how to really make people feel better faster.
Totally.
Because we don't want to wait around for 13 sessions to know that something's going to work.
No.
We want that buy-in immediately, and I feel like there's a sales side to this, which is articulating the science, but then also articulating how, walking somebody through that process of how we had pain, and then now in just a few minutes, the pain's going down and understanding why that happened so fast. And I have to say that this technology, rapid release, has really impacted my professional platform, because I feel like I've got a pill that everybody needs, and I can get it to them faster than with other modalities that are still wonderful. I mean,
Sure.
I still have this. I own a percussive device, but if you can get there a little faster, it's a cheat code.
Oh, absolutely. And I've also learned along the way that it's rarely one thing that does everything, right? It's like, this works. This has its like zone of genius. And then if I do this with this, because people will ask me like, well, what's your morning routine? I'm like, well, how much time do you have? Because it ain't one thing. You know, like this morning, I'm on my PEMF mat doing my visualization meditation after I've had my 8 ounces of water, right? Before I go out and ground with my bulletproof coffee with protein in it, all within and get my sunlight. And that's my first 15 minutes of my day, right? And so it's like boom, 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 right? It's not one, so anytime you come across another piece of the arsenal, for me, shout out to my favorite soccer team, football team in England there, please have me come over and interview your trainers, please. Sorry, desperate plea. YouTube, you heard that, right? But anytime you can add something to the arsenal, you notice suddenly you're like, oh my God, the results I'm getting are so much better than I was doing something else and it was good. And then I discovered this other thing, and now it's even better. And my journey in this whole podcast world and in the pickleball world, you know, started on a PT table, but then went into the chiropractic world. But then within the chiropractic world, they each had different modalities that they had discovered along the way that they brought into their practice to add. I see 2 chiropractors. They're specialized in different modalities. One, I'm going for soft wave to get this treated. The other one's doing targeted, it's just going to kill me.
Like a vibrocuss or something like that?
I can't remember the name of it right now. Oh my God. Never mind. So sorry. But point being that once you find these little things, they take your recovery up another notch. And you're grateful you have it in your toolkit. When I first saw one of these, candidly, it was on the interview that you did with Tyson, because I had taken Tyson's camp, and at Tyson's camp, he had compression boots there for everyone to use. And he was the first person that kind of tuned me into recovery for pickleball. I was like, oh, this is a thing. And then I find my way to a chiropractor one day, and I see one of these in their practice, but I see a big power cord wound up around it, and it looked like something in my garage, quite frankly. And I thought, well, I can't bring that in my bag. Like right away, it was like, that sounds great, but you know, my stepdad's power drill that's you plug in is way better than my battery operated drill. I understand this, but my battery operated drill goes places that one doesn't. So I'm very excited to see what we have here is a portable version of this technology. How long has this been around, and are you excited about this? Like, talk about the evolution of it.
100%. So that specific product launched about 3 years ago.
Okay.
And the reason Matt and I are so excited to join you is because we are in pre-launch mode of 2 consumer devices that are hitting the market sooner than later.
Okay.
So we'll be finally able to provide pickleball fans and athletes something that they can leverage immediately and get the same benefits of our Pro 3. Now, why I say that is our device has, with individuals like Matt, really been focused on the practitioner.
Yeah.
Right? People roll off the table. It's pro label.
Yep.
And it is a registered medical device. I don't know if you know that.
Nice.
So a lot of people roll off the table and they go, oh my gosh, I want one of these right away. I have a Therabody.
Where do I get it?
I have a Hyperice. But the price point has been
and then
an
they're
issue.
like,
yeah, right.
There's one too many zeros.
That's right.
Take a 0 off that, and I'll buy 4.
There you go. So we are coming out with new products that we believe in the health and wellness space are really going to be disruptive, number one. Number 2, they're going to allow everyday man and woman to go and get something off the shelf and enable them to use this at home.
That's great.
Now, we still have the therapist device that we want to tell everyone,
Sure.
hey, listen, there's variable speeds. So the Traveler is our portable device, fits in your pocket, in your purse, in your gym bag.
Brilliant.
That goes 4,000, 5,000, 6,000 vibrations per minute.
Okay.
The next one up is called the Pro Am for professional and amateur.
I like it.
That one goes 6,000, 7,000, 8,000, and 9,000 vibrations per minute.
Okay.
And this is the big dog that goes 10,000.
Yeah.
Right.
That's
so
this is the V8, right?
that's the VM. So you'll see a lot of our professional athletes like Jameis Winston. We've got, the Tampa Bay Rowdies. We've got celebrities
Nice.
like Leanne Rimes, and we've got Danica Patrick that use our device. You'll see a lot of these individuals behind closed doors using our technology. Again, the price point has been a little inhibitive to using in the consumer space. But now that we're coming out with new devices, people can go to someone like Matt. They can drop in. They can experience the technology. We want them to be baseline tested. We want them then to go, okay, Matt, Matt, what's the recovery process I need?
Yep.
And from there, Matt can say, okay, here's what you need to do. Come and see me X amount of time. And, oh, by the way, take one of these home for at-home use.
Yes. Yeah. And that's really smart because part of the, I love that this morning you said, are you a fellow health nut on the phone as we were talking? And I laughed because I was like, yes. But like being a health nut is like a spectrum disorder. Like you can be a health nut all the way to a self-proclaimed biohacker, but there's no certification for biohacker. You just say you are. And there's a limit, there's always a limit to your knowledge. And that's a dangerous thing, right? And if you're not working with a mentor who's certified or trained in a modality or a technology, you can do harm in a lot of ways, or you can do nothing.
Right.
You're just not using the product the way it's supposed to, or for the amount of time that's going to make a difference. Like people are like, I went to the gym and it didn't do anything for me. Really? How often did you go? Once a week. Like, oh, okay. Well, maybe there was something in that. Maybe if you had worked with a trainer who was certified, could have told you, if you want this result, this is the amount of exposure it's going to take. And I think once you have that client connection with a practitioner, like in PT, I had homework all the time. I was like, I'm back in school as a patient because every time I went to physical therapy, they sent me home with exercises and homework. And today it's on an app. Like, here's our app, here are the exercises, but you've got homework to do. It's all about what are you doing on a daily basis. But if you're not doing the right thing, as one of the physical therapists that was a guest on our podcast said, the right exercise done the wrong way is the wrong exercise. Right. So that key piece of coming to you first, getting the lowdown on the correct way to use it. Form matters, reps matter. Exposure matters.
Yeah, so, you want to. I was going to say you want to protect your investment. These modalities are, not inexpensive.
Yeah.
And so to know what you're doing with the tool and to have protocol manuals.
Yes.
There's one for the consumer, and then there's also one for the professional, which I think kind of separates from a lot of other modalities. But the comment you made about home exercise programs. How many people have been to physical therapy, and they get this cookie cutter sheet that has all these exercises you could be doing at home.
Yep.
Half the exercise they do in the clinic setting can be monotonous and cookie cutter just to manage a high volume clinic.
Yeah.
But what I always say is when you can treat somebody and give them, this wow factor in just a few minutes and change their pain level or improve their mobility significantly in just a few minutes, what's really cool, my strategy and our PTs out in Arizona, is that you can get compliance real fast. When somebody feels like, oh my God, I've been to PT for 55 years, and I've never had results like I did in this few minutes. So the first question they'll ask, which I think is a validation for the device and how it's been used, is how long is this going to last, Matt? I mean, I can dunk a basketball now, but am I going to be able to do it tomorrow? And it's like, remember, you weren't dunking a basketball yesterday.
Right.
But it's just an example of how extreme people feel, but then they say, how long is this really going to last? And then you hit them with, you'll probably lose about a third of that range of motion or that pain relief relative to, I'm going to sleep in one position for 8 hours. I might go hike, Mount Everest overnight because I feel so good. You're going to adaptively shorten. So we set expectations that they're going to lose about a third of that feeling, that range of motion, but you still maintain and gain 66% of it. Okay. But then the cool thing about that is now you say, if you want to maintain 100% of that feel-good feeling, that mobility, what you do is you go through these 3 stretches or these 3 treatments that I provided you that are very simple, structured. They saw that it worked, and they then are going to go home and actually do it because they want to keep that good feeling alive. And I think that is where you pull this whole thing together and create an experience they've never had, and you get them compliant. Then they have a long-term carryover effect, and it makes you look good. They love it. It all comes together.
100%.
Brilliant.
Yeah.
Brilliant. So, all right. I love putting people on the spot. So right now, as a 51-year-old pickleballer, as you've already seen on camera, I'm nursing the ankle, but I have like a right lateral meniscus that gets cranky, and my patella tendons, if I'm playing and it's under 70, it feels like my knees are tight, right? And it just feels, that like range of motion. So if I go to do off camera, everybody, I'm about to do a squat in front of them. You'll see, here's my little squat demo for you. I got enough room with my chair. So if I go down, I'm okay. I get to here, I'm okay. I can't keep my back up. I can't straighten my shoulders. I can't, and both knees crack, 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 right? And I don't know where the impingement or where the loss of range of motion is in that just one movement, and what's one way this device would open up, whether that was just my knees as I was talking about, or it was my shoulders. How would this help me?
Sure.
Wait, before you answer, really quick, have you tried our technology?
That's why I said bring it out, because I wanted to.
It may be a real world example that we should, when you answer, maybe you want to give him a little bit of treatment and work him through a couple of your protocols, see if we can.
I think we let the viewers come back for another one on that, but I'm going to talk through. We'll keep them guessing on that. But the first thing, which I love, is when somebody has a real impairment and it's a functional limitation.
Yes.
I wish we had our stretch gauge here, because we could basically show you, it would be a high, you'd alternate in march, you'd squat, you'd signal to the video that, hey, I've got pain on my right side. What we'd see is you'd probably deviate away from that side because you're feeling apprehensive, right?
Yeah.
Guarding, okay? And this is how it plays out so perfectly. Then we'd go through a treatment. What I'd predict is that the side that's more restricted, that's more painful, has more fibrotic tissue. It has probably more restriction on the quad, the hamstring, the calf. So I would literally go through and loosen up the quad first. Because of the anterior knee pain, it would unlock the patella, let it slide and glide. I would hit your hip flexor because it's part of the, it's connected to the quad.
Yep.
So you're providing more slack on the anterior surface. Then I would take the calf, hamstring, and we can do this in a few minutes, but you would loosen up. Then I'd have you go back into that squat, retest that.
Yep.
And you would find that you're now going over to that right side to squat because it's welcoming the range of motion that the left side, that was the uninvolved control to the experiment, did not have. And so you can see in real time how the WD-40 effect really is in play, and then now you're more functional. So not only did we treat the pain, but you actually want to perform on that right leg relative to the left, and it plays out like that, thousands of times when we go through this.
That's really interesting.
So I would welcome the viewers. Stay tuned for another episode where we actually show the video of him getting treated after this podcast today, so that keeps you guys tuning in.
Well, I appreciate that, because I know that in my head, and we had a great conversation with the guys at Go Sleeves about this, the psychology of fear when it comes to guarding and protecting your body. And that piece of it, it's like a vicious circle. It's like a feedback loop. Like, you detect some tightness or weakness, and most of us can't tell the difference between the two. We don't know if it's tight or weak, right? We'll stretch a weak muscle instead of strengthen it, or we'll strengthen a tight muscle instead of loosen it. We don't know enough, but we know something's off, so we go into compensation mode. But this is all happening subconsciously. The body, the attention center of the brain doesn't have the bandwidth to be having these kind of eloquent conversations with itself, checking with the department. How's your range of motion today? Check. How's your strength? Check. You just go, right? And then your body adjusts on the fly, and there's parts of your brain that are dedicated to that. That's not the part that's listening in on this conversation, but it's making a difference on how the body's performing. And once you can relax that signal enough to where it turns off that danger alarm, then the rest of it suddenly seems to open up. And I know right now it's a vicious circle with my right knee, because I reached down for a ball, felt a really sharp on Thanksgiving morning, ow, right? And then now brain, remembers when I go there, that may happen.
Right.
So now
you're guarding against it.
Exactly.
So you can't perform at optimal level.
All kinds of things are happening. Now, how that shows up in my game is my forehand dinks stink. But my backhand dinks all day because I'm totally comfortable loading this left side, getting super low, dragging. I get holes in my shoes because I can just drag this leg because I can come down as far as I want on this leg because that kind of vicious circle, that feedback loop isn't there on the left side, but it is on the right. I don't think, candidly, that I have some sort of mechanical or structural damage that's so bad that I can't do that. I think it's more of a mind, muscle, nervous system kind of knot.
Well, and that's what I was saying. So you're going to de-weight that right side
Yes.
and head over to your left because you're more comfortable. So it's predictable. 9 out of 10 cases, they're restricted. The pain is going to have you deviate away from that. And so if I can get you mobility in minutes, unlock the patella, allow it to slide and glide, then you actually want to go down for your forehand dinks. I always say from a optimal range of motion, you want to be able to get down, keep your chest square, and go through that dink for 2 reasons. One, you're more mechanically efficient. You won't hurt your back having not dipping down, but then you're also ready for that return that comes right back at you because your chest is up.
Yep.
So I always explain to my pickleball clients, especially the pro athlete, that I'm saying, let me buy you that range of motion so you can get down lower, avoid injury, but then 2, you're also ready for that quick pop back.
Yes.
And so your performance is elevated.
Yes.
So you just spelled it out with your case that once we get your WD-40 effect on, your central nervous system is the secret to the whole thing. If you can take that, down-regulate the brain, or I call take the governor off the golf cart.
There you go.
Then you are free to perform. And just like a therapist, I'm free to perform, to open the door, loosen up muscles because I took that restriction away, that guarding that is, inhibiting, the muscle from moving. So it's really cool how your case really ties into the big secret sauce to how this technology can really impact the central nervous system, allow a therapist to treat you faster, and then you get back, perform better.
Yeah. Yeah. So, I look forward to that. Where do people find you online and you all online? Because I know there's a couple places we can follow you.
Yeah, rapidreleasetech.com is where you're going to find the technology. And again, portfolio of beautiful technology that has changed my life and a lot of my clients out there. And then targetedvibrationtherapy.com is where you find the education platform around how to use this as a consumer, but more so a professional. You can get certified. We have online courses and so on and so forth. But, I'll let Calvin speak on the technology, but it's changed my life as a professional.
Now, we work in a synergistic way. So with the professionals, i.e. therapists, we're introducing the technology. Most of them have found it through a referral or experiential treatment, and then they want to fast track. And so I say synergistic because when they're ready to fast track, no one wants to go back to college for years to learn how to use a modality.
No.
Right? So we send them over to Matt, and Matt has an online and in-person classes where someone can learn quickly how to use the technology and get the return on investment for our device.
Brilliant.
Most therapists, 30 days, they're making money, successful, helping clients in and out of pain, and they're moving forward, right? We have few people that are not successful with our technology. But he's kind of the key because we do believe in education in a big way. Most of these percussive devices, again, I have one, Matt has one, you have one. Most of them you're going to pull off the shelf.
Yep.
And you're going to go to work.
Yep.
Right? May not know what you're doing.
Yep. Zero amount of training.
There you go.
Zero
Feels
minutes.
good.
Yeah.
Feels good. But
if you can reach it.
What's the end goal? Right?
Yeah, totally. And then Instagram, where do we find you guys?
So Matt Gloyd, DPT.
Okay.
You can find me personally, but also Targeted Vibration Therapy. We have 2 different sites out there.
Cool.
And we're Rapid Release Tech as well.
Okay. Awesome. Gentlemen, thank you for joining us on Pickleball Recovery.
We enjoyed it.
Appreciate it. Had a blast, and we're going to treat you a little later.
Okay. See ya. All right, so here we are. We're in the gym. Promise is fulfilled. What are we doing to me?
All right, so we're going to baseline assess what you have going on. So let's alternate and march the knees up and down. Get them up there. and then just kind of get
as
a
far
sense
as I
for
can.
yeah,
Okay.
just and just get a sense for what you're feeling on the right knee
Okay.
relative to left. Any restriction at all?
No, mostly the restriction is in my hips.
So then go into a squat. So bring your feet wide.
Okay.
And then go down into a squat and give me a few of those in a row just to kind of give some feedback on that right knee relative to the left knee. Is the right one more restricted? More uncomfortable?
It's not bad. It's usually if I have to
laterally
load.
Okay.
Then that's when it's that.
Let's go through it.
Okay.
This is we need a signal. What
So
the
if I
problem
come
is
down
first.
here,
Okay.
weakness and
Compare the other side.
oh yeah.
Okay, so freedom,
And just
restriction.
Yeah.
Okay.
Yeah.
All right. So now we're gonna go through and stretch the quad. All right. So this is where we're gonna put the quad on stretch. We can tell that because he's so restricted into that range already, there's opportunity to improve the situation. Okay. So what you're gonna do is rock back and forth. So get into the stretch and then back off a little bit and then
Okay.
keep that cadence going. Okay.
Okay. All right.
I'm gonna sit here and manipulate the connective tissue above the knee. And then what you're going to notice is that signal that said, hey, I can't go back any further, that governor on the golf cart we talked about,
Right.
is going to start to really release and you'll have more range. Okay? Okay, good. Now bring that foot down for a second just to reset. This is just more to get the brain to relax.
Okay.
All right, now put it back up. And you'll notice that you'll have more range the second time. Now go ahead and lean back. See how much we got, about 10 degrees of range there. Just,
yeah.
And then go ahead and hold on to the dumbbell back there. We're actually at a fitness center and just kind of improvising today, but we're making it work. So keep rocking forward and back.
Okay.
Normally this can be performed in a stretch cage or on an exercise table. So right now we're making this work, but the manipulation around the lateral aspect of the leg, the patella tendon all the way to the hip flexor, we're getting more WD-40, more blood flow, and creating a better environment for that knee. Good. How does it feel as we're manipulating?
I can't believe how much more range of motion I'm getting and how quickly I'm getting.
And then you can use this actuator tip. This is one of my favorites where we can actually trigger point release that
There it is.
TFL,
Oh,
the
yeah.
flexor, and so all those modalities out there, all the plastic products that people lay on the floor so they can release their
Oh,
psoas.
so awful.
We don't need that anymore. We got a manipulation on steroids. Good. Take a break. Okay, now go ahead and march the knees up and down just after literally 2 minutes of work.
Look at that.
He's going to be able to tell that the right leg should go up more free, it's
yeah.
lighter. Okay, now go into that squat.
Yeah.
Okay, we're not all the way there yet, but you should feel there's a
What a
little more
difference.
pliability, WD-40.
Yeah, and what I notice instantly is not only can I move more smoothly through the motion, I moved safely, if that makes sense. Like my brain was very calm just because it feels good going through it. I feel like there's like this, oh yeah, it's okay, it's okay, it's okay, it's okay, it's okay, it's okay, it's okay. And right away I'm like, oh, now I have the confidence I can go back down on that. But just to try to get a sense of what that felt like through the range of motion, the first time I did it, it was like, and now it's just like,
So it's sliding, gliding, the
sliding
connective
and
tissue.
gliding is moving.
So
Unbelievable.
what's crazy is that when you stimulate fasciitis, let's geek out on physiology, you secrete hyaluronic acid, which is what I refer to as this oil, this WD-40 effect. So what we did is we manipulated, generated some of that hyaluronic acid, we added blood flow. So now when he's going into that squat, the patella will slide and glide, the muscles will slide and glide, and then now he's more mechanically efficient and the pain has gone down.
Right.
Here we just kind of improvised by putting his leg in a hamstring stretch position. So what you're going to do first is point the foot up and down, and you're going to floss the tension from the bottom up, okay? I'm going to sit here and manipulate everything from the Achilles, gastroc, soleus, eventually to the hamstring, and I'm going to have you actually turn your chest that way so you get a little more.
Yeah.
Now you got an adductor stretch.
That activated.
Okay, most people, we don't stretch outside of a standard sagittal plane. We need to start changing angles of how we stretch. So when we play pickleball and we're randomly changing directions, we're more prepared for it. So now windshield wiper the legs side to side, just like that. And you can put that left hand on that dumbbell just so you're supporting yourself. So I'm taking 2 of these rapid release Pro 3s, right? And we're manipulating the medial side and the lateral side at the same time, trying to buy him more slack so that his knee, his patella has more slide and glide, and he's gonna feel amazing for his pickleball match later grip. Okay, and again, the actuator tip just so you can feel how manipulating on steroids, and then it releases the central nervous system, allowing for more range of motion. Good, take a break. Bring that foot down. Now you're gonna put your foot here.
Okay.
And then you're gonna kind of lunge forward and back. So actually bend that knee and lunge forward.
Oh, more like that.
Yeah, and then lunge forward, lunge back. Yep. Same thing, we're taking you in functional positions. And then remember, you mentioned that you lateral lunge to the right like that. So anything that is restricting you from lunging to your right, we're gonna free it up.
Right.
And that's the secret sauce to how we get it done. Okay, now turn your body to your left, but then right lunge to your, yep.
Okay.
And then I'm just manipulating again the lateral aspect of the leg, the hip, the knee. And then eventually, we're gonna go back to our baseline assessment, reassess it, and find that the right lunge is actually pretty darn comfortable. So turn your body and then right lunge. Yep, you got it.
Oh yeah.
And again, I'm just using some of these different heads on the vibration tool so I can manipulate connective tissue that is probably guarded, tense, fibrotic. Okay, take a break. Okay, now go into your right lateral lunge.
Okay.
So that you can simulate what would happen in a pickleball game. Freedom?
It's cake.
So Xanax on the right, now the left is probably missing something. It may be a little more restricted than it.
That's so funny. Now the left knee, like as I go down, now this is tighter than this.
Right,
Yeah.
which is predictable. At the beginning of this, we actually predicted that the side that was restricted and painful, you would deviate away from it or you'd feel guarded.
Right.
But by the end of the treatment, you'd actually welcome that squat, that lunge, and then the left side that we didn't work on, which we consider the control to the experiment, is now wishing it had a little oil from vibration.
I can tell the difference. Hey guys, so I just finished up having Dr. Matt Gloyd over here work me with the Rapid Release 3 technology using the TVT, his targeted vibrational therapy on my right side. And there's something I really want to say that we talked about in the podcast really quickly, which is the difference between doing something on your own and when it's in the hands of a trained physical therapist or practitioner. He just used these devices on me in a way I couldn't have predicted or thought was possible. I would never have used this on my own. If he had given me one today as a gift, I would never have used it as effectively as he just used it on me. So as you're exploring this technology or any, first have someone who is trained in that technology use it on you so you understand how to use it most effectively and safely on yourself. Thanks so much for listening. Did you know there's one place on the web for all your recovery needs? It's at www.pickleballrecovery.com. You'll find all the products I personally use and recommend, along with exclusive discounts on many of them, as well as my blog where I help you make sense out of all the different products and practices out there to keep you moving and feeling better so you play better. After all, your body is the most expensive piece of equipment you own. Also, do you want to know the #1 mistake picklers make that leads to increased pain, soreness, stiffness, and injury? Just head over to pickleballrecovery.com and download my free guide to playing with less pain and more enjoyment. Listen, pickleball makes us feel young at heart, but not young in body. So go download my free guide at www.pickleballrecovery.com. See you next time.